Blood supplied to the heart, the left coronary artery. The human heart is the muscle that supplies blood to the entire body, but for it to do so, it needs blood for its own functioning as well, and that blood comes from none other than our own heart itself. The part of the circulation that supplies blood to the heart is called coronary circulation. It includes the coronary arteries, which oxygenate the myocardium. Myo means muscle, cardium means heart, and the cardiac veins, which carry the deoxygenated blood out of the myocardium. It must be understood that for the entire body to receive an endless and steady supply of oxygenated blood day in, day out, 24 hours a day and 7 days a week, the heart is required to function constantly without the slightest interruptions. This naturally means that its own circulation is of vital importance, not only to its own tissues, but to the entire body. Two coronary arteries originate from the left side of the heart at the beginning of the aorta, right after the aorta exits the left ventricle. 3 aortic sinuses emerge from the wall of the aorta just superior to the aortic semilunar valve. The left posterior aortic sinus gives rise to the left coronary artery, and the right anterior aortic sinus gives rise to the right coronary arteries. The third sinus, the right posterior aortic sinus, typically does not give rise to a vessel. Left coronary artery LCA. The left coronary artery LCA will distribute blood to the left side of the heart, which includes the left atrium, left ventricle, and the interventricular septum. The first major branch of LCA is the left circumflex artery, which travels and supplies blood to the left side of the heart muscles, also known as the left atrioventricular septum. The name circumflex suggests it goes around in the septum towards the posterior surface of the heart, where it will eventually anastomose with the branches of RCA. The second major and larger branch of LCA is the anterior interventricular artery. Anterior interventricular indicates that it lies on the anterior surface of the heart and travels in the septum, in between the two ventricles, hence interventricular. It is also known as the left anterior descending artery, LAD. Numerous smaller branches emerge from it that combine with the posterior interventricular artery into anastomosis. The interesting fact is if the artery is blocked, the heart can stop really fast, which is why any occlusion of this artery is deadly. It is very rightly named the Widowmaker. In addition to these two branches, many small atrial branches that supply the atria and ventricular branches that supply the ventricles also originate from the main trunk. In the next video, we will continue to the right side, along with the secret mechanism that the body has in store to help with heart issues.